Okay.
The dollar store.
Whenever you want to start.
All right.
All right.
Can lead off.
Sounds good.
Hi, everybody. Welcome back to Anchor Podcast number 2.
Number 2.
Yeah, featuring baby Logan.
This is Logan. Say hi, Logan.
So we wanted to chime back in and touch on postpartum and even just having a baby and, you know, the whole process that you went through as being a first-time mom. And I want to ask you, Dr. Alli, like, you are an overachiever, you are a goal crusher, you are a busy businesswoman, entrepreneur. How does it feel now for your life to slow down, and what's it like to have a baby?
Wow, like, sometimes
question.
I'm speechless. My brother-in-law asked me, like, soon after Logan was born, like, what's it like being a mom? And I just looked at him and I'm just like, I don't know. I have no words. You know, it's interesting anytime somebody calls me an overachiever. I hear that a lot, and to me, I'm just an achiever. Like, I know what I want, and then I go and get it.
For sure.
And I mean, having a baby was kind of no different in the sense that, you know, I got married, and I was 29, and life was going well, I had jobs. We just opened up Anchor. Actually, I found out I was pregnant, 4 weeks after we opened up Anchor. But I knew that I was ready. And not ready in the sense that I had my shit together, because I don't think anyone's ever ready for what it feels like to have a baby, but ready to make the mindset changes that come with being a mom.
Yeah.
Yeah, and that's the big thing, Shannon. It's the mindset. The biggest piece that's resonated with me is a nurse that said to me, because they probably identified what you just said, is that, oh, this woman's an overachiever. Like, they hear what you do for a living, that you own a business. And she said, Alli, the stats are that higher educated women, so women who've gone through post-secondary education, have a 33% higher chance of developing postpartum depression, is what she said to me. And it's very real. You hear about it a lot, and I think people are much more open to talking about that now. So you're almost a little scared, like, because you can't control it. It's completely hormonal, but you can set yourself up for success.
For sure. What does that success look like for you?
So that quote that I just shared, the 33% higher chance of developing postpartum depression, I had to make the choice to say no to things. It would have been very, very easy to try and push myself to be back in the gym a week after and show people, if I can do it, you can do it. But that wouldn't have been serving my body, wouldn't have been serving him. To feel like a piece of shit sitting on the couch for hour number 8, because you have a child now, and we have a new puppy too, when I'm used to seeing patients and changing lives. But giving myself the permission, I mean, you say it all the time, permission to do less, and the permission to just be with this amazing human being that we just brought into this world.
For sure.
And that's been the single most important thing I've done for myself, is say no to things, ask for help when it's needed, and allow people to help me, because I wouldn't have allowed people to help me before. And that's been huge.
Yeah.
It's been huge.
So for your fitness, how has that looked through your pregnancy? What did you do to not get your body back? Because your body's not going to go back to what it was, and you just had this child, and that's amazing. So how have you developed a different mindset around that, and what are some best practices? So
fitness during, just listened to my body, and I'll tell you, my body told me don't do a whole lot. As a chiropractor, I'm on my feet all day, every day. So I was tired, and I obviously had to keep working, and as I got bigger and bigger, work got harder and harder. So I had to give myself permission to be okay with less and less fitness. 1 to 2 workouts a week, just walking. I mean, adjusting patients and treating patients was physical fitness enough. Postpartum fitness, I knew early on, I love fitness. It's a big part of my life. And obviously one of our hopes and dreams for Logan is that it becomes something that he loves to do as well. So I knew it would be something that I would want to do as early as possible. So I started early on seeking out people that I resonated with to figure out what my postpartum fitness would look like. One person that is a big influence on me is Dr. Lindsay Matthews in California, and she started something called BirthFit. So I actually have been doing her postpartum fitness program while simultaneously launching one here.
Yeah.
Launching one here.
Awesome.
So being a chiropractor, doing kinesiology undergrad, I'm educated in the postpartum woman. I'm educated in pregnancy, in the anatomy. But the life that is when you have a child is not something any textbook can teach you. And I'm going through it just the same as anybody else is. And so I'm just letting my experiences happen to me. But Shan, one of the things that I knew was going to happen, and now I've experienced it, is nobody checks out the mom physically.
Right.
I've had great care in the sense that I had midwives and nurse practitioners who said, how are you feeling? And going through all of that and help with breastfeeding and lactation. But not once has anybody checked me out physically. And I'll tell you, back pain, hip pain,
It's real.
even just like holding him, how weak my core feels. There is no way that at the 6-week mark that I should be back in CrossFit trying to be the person that I was a year ago.
For sure.
No way.
For sure.
And again, that's back to the mindset piece that I need to give myself permission to be okay with that. It's hard. It's hard. Of course, I wish I popped out this baby and the next day was climbing up to the top of the rope. I mean, who wouldn't? But that's not real human body
Your life
physiology. Yeah. What do you? Oh, go ahead.
If you could give advice, one piece of advice to a new mom that's going through what you just went through, what would it be?
Oh, well, I think being okay with help, but I wanted to create a space here where people felt comfortable bringing their baby. And if I didn't have the gym as a place that I worked, there wouldn't have been anywhere that I would have felt comfortable bringing Logan. Just the whole new routine of feeding him, changing him, and just if he cries, what do you do? I really wanted to create a space where I don't care. If you need to feed your baby, if you need to leave halfway through, if you come in your pajamas, I don't care. Come here, let's take care of you. Let's take care of baby. So if I could give moms advice, it would be to find a place. It's going to feel uncomfortable, but find a place that you feel that uncomfort or step out of your comfort zone and allow it to be a source of support for you. Find the support.
Second home.
Yeah.
For sure.
Yeah. So we just finished up our first session of the postpartum fitness. It's been so awesome connecting with other moms and teaching them about their bodies and not having people show up to CrossFit and say, I want to lose 20 pounds, I want to do 600 burpees, and go. But working on their pelvic floor and doing chiropractic to help heal their bodies. Heal their bodies.
It's awesome. So what's upcoming for you? What do you see for yourself in the next year?
So I want to bring baby to life with me. I want to bring Logan to life with me, and we're so fortunate that we have a great facility here where I can work and he can be here. I mean, we're kind of working right now, and he's here with me. So continuing with chiropractic because it just feels like the difference that I can make in everybody is so important. But adding on a layer of care through pregnancy and care through postpartum as well, and becoming an advocate for women. I would love to align myself with other people in the community who have that same outlook for women during pregnancy and postpartum and babies too. Continuing with this postpartum fitness program, like I said, it's been amazing to be able to give this foundation to women so that they're not coming to me in 3, 4, 5 years with low back pain, diastasis. So it's been pretty amazing. Sometimes I'm at a loss for words because I can't believe how life has changed, but also stayed the same and just kind of adopted this new human being who's part of me.
You heard it from her. Thanks for joining us. We'll see you next time.
Bye guys. Thanks.